This is Dr. Sanchez again. I'm the Medical Director for Family Practice Center, and I like to talk about different topics that have to do with things that are common for our community. Today I'm going to talk about impotency and erectile dysfunction and the risks of just having these two things. Because some people say, well, I can't have sex anymore, I have this problem, and they think that is benign, that that's all there is to it. But let me tell you one thing. People that have erectile dysfunction, that have impotency, are at a higher risk of having other illnesses. Most of these people, most of these men have diabetes, not all of them, or they're pre-diabetics and they don't really know they have diabetes yet. The other thing is that many of them, a large number of men that have this problem, have hypertension. Some of them have been on treatment for a while, and they also have hyperlipidemia or high cholesterol. People that have high cholesterol, high triglycerides, and that are on treatment with statin drugs, with medication to lower the cholesterol, they also have a higher risk of, they also have more commonly erectile dysfunction. So these things go together. We found out also that men that have impotency and ED have a high risk of heart disease. Okay, because and why do they have this? Well, one of the problems, the reason is that impotency and erectile dysfunction is a problem that has to do with the arteries. The circulation is plugged up. You know, there's arteriosclerosis, that the arteries start plugging up little by little with plaque, and so then it doesn't function well anymore. So I guess the theory is that if you have some arteries that are plugged up, the heart arteries are going to be plugged up as well, and they can be. Sometimes, like people who have heart disease, they have also the carotids that are arteriosclerotic, because it's a generalized arterial or circulatory disease. So, very important. Anybody that start having problems with sex, having intercourse, it's very important for you guys, the men, to check themselves. Come to our office or to your own physician and tell them about it. You have to be open and tell them what the problem is, so that the doctor can start doing the proper testing and trying to figure out what's wrong. And not only the sex problem, but it could be a more ominous symptom. It could be a more ominous problem, like heart disease, cerebral vascular disease, like that can promote strokes and things like that. So anyway, that's it. Dr. Sanchez, thank you. Call me if you have any questions, or come visit us at the numbers on the screen. Thank you.